Hi everyone, it's me Dr. Mazhar and you are watching medical lecture of neurology. In neurology today I will talk about Alzheimer disease, which is very common in older patient as well as in old age patient. Why? Because in old age patient there is some neurodegenerative changes happen or occurring in the cerebral cortex or in the neuron, so that disease is very common in old age patient as well as compared to young patient. Why? Because with age there is a cerebral cortex atrophy occur, because when patient become older age, 30, 40 or 50 plus age, so his or her cerebral cortex becomes shrink and there is some neurodegenerative changes. That changes, as a result, they give clinical features like dementia, which is a very common symptom of that Alzheimer disease. So let's come toward its introduction or definition, you can say. So actually Alzheimer disease is a degenerative brain disorder without that can have unknown etiology, can be due to age related, can be due to any infection, can be due to trauma, can be due to stroke, but most of the time it is unknown etiology, which is the most common form of dementia. It means what? That in that disease dementia is very common. So if there is dementia itself is a symptom, so very dementia very common cause is what? Alzheimer disease. If someone develops some dementia type of symptoms, clinical features, so you can think about Alzheimer disease. That can be, dementia can be occurred due to other diseases like in Parkinson disease dementia can happen, or in the hydrocephalus dementia can happen, or in traumatic injury like post head injury or intracranial space occupying lesion like any glioma, any mass can also lead to dementia, or subdural hematoma can also lead to dementia. Some vascular problem like cerebrovascular attack like stroke can also lead to dementia, or decreased oxygen supply to the brain can also lead to dementia. Even sometimes respiratory failure can lead to dementia. Some metabolic causes like uremia or renal failure or liver failure can also lead to dementia. If you talk about endocrinology, that hypothyroidism or hypocalcemia can also lead to dementia, or vitamin B12 or thiamine is also cause dementia. But in here, so Alzheimer disease is a very common cause of dementia in old age. So that disease usually start in the late or middle age or in old age patient. So in old age patient, this Alzheimer disease is very common due to shrinking of cerebral cortex, due to neurodegenerative changes, due to the self newly formed selling. Because when neuron become damaged, neuron never again replace. If any, for example, in the liver tissue like hepatocyte, they can regenerate, but neuron when become damaged or destroyed, it never regenerate. So resulting in what? Progressive memory loss, patient slowly memory loss, or forgetting problem, impaired thinking, patient cannot think well, patient become disoriented, that patient don't know where is she, who is around her, what's going on, what's going around her. So patient don't know about, patient disoriented with time, place and person, and change in personality and mood, that patient mood become changed. Sometimes patient become happy or sad, most of the time patient become sad, because patient want to memorize the thing but patient unable to memorize the thing. So this is a major feature, that this all are the clinical feature is very important according to dementia. What? There is a memory loss, there is impaired thinking, disorientation, change in personality and mood. So there is a degeneration of what? Brain neurons. When degeneration of brain neurons happen, patient slowly loss of consciousness happen, patient slowly forgetting the things, patient thinking become less. So this is due to what? Degenerative of brain neuron, especially of what? Cerebral cortex, because cerebral cortex is the one which is a motor system, which is the highest center. Also hippocampus is also affected in that disease, and in the presence of this and what's the main findings, or you can say that what's the main biomarker in which you diagnose this Alzheimer disease? If you are suspecting that this patient have Alzheimer disease, so how you will diagnose, how you will know? So there is a neurofibrillary tangles. Tangles mean abnormal collection of proteins. Protein what? Tau protein. So NFT. So neurofibrillary tangles mean what? There is a abnormal collection of protein or abnormal twisting of protein. That twisting we call what? Tangles. And plaques containing beta amyloid cell. So amyloidosis, like in which there is a beta protein but abnormal shape. So abnormal shape beta plated protein also accumulate in the cerebral cortex, and they also lead to dementia. So this is the main biomarker or main finding in which how you diagnose the Alzheimer disease. So in later I will talk about the major its pathophysiology. So this is the thing how you will know. So this is a histopathology. In normal there is a normal neurons, cell bodies, and there is a dendroid. But in Alzheimer disease, what happens? There is a neurofibrillary tangles. Tangles mean what? Abnormal mass due to abnormal twisting. For example, when protein become twisted, they become abnormal twisted. Abnormal twisted make a mass. That mass we call what? Tangles. So that's why we call neurofibrillary tangles. And abnormal mass formed by what? Proteins. That protein we give special name. That protein we call tau protein. Tau means 6 proteins. So that 6 proteins when abnormally twisted each other, and they make a mass. That mass we call what? Neurofibrillary tangles. And then there is a, you can see there is a amyloid plaques as well. So this is a major feature of neurofibrillary tangles which occur in the Alzheimer disease. So in next I will show you how it forms. See, this is a axon, this is a cell bodies, this is the axon, this is a dendrites. Okay, this one. So what happened in the normal? There is a healthy microtubule. This is the healthy microtubule. This is a present here, and this is a we call tau protein. Tau protein is we call 6 proteins. 6 protein mean 1, 2, 3, 4, 5, 6 protein. And what's the function of this microtubule? That why they stabilize microtubule? Because microtubule is the one, for example, when any neurotransmitter which are formed inside the cell body, then their neurotransmitter travel through the axon and then they transfer to the next neuron. So how they transfer? Actually, that microtubule is the way through which neurotransmitter pass through, and they enter in their destination point. So actually they just give a bridge. For example, they just give a bridge. Through this bridge, that neurotransmitter pass through and they enter in where? In the synapses point. So this is the main function of microtubule. Actually they act as a pathway. They give the support or give the pathway that how they support or they help the neurotransmitter that now you are found, now I will help you, that how you transfer to the synapses point. So when these proteins become destabilized, for example, when these proteins become detached from this microtubule, so microtubule function become disturbed. So now that microtubule can never transmit or never pass the neurotransmitter properly from the cell bodies to the axon and then to the synapses point. Then that tau protein become twisted, they form aggregate and they become hyperphosphorylated. When they become hyperphosphorylation happen in that protein, they twisted each other, and that twisting we call what? tangles of tau protein. Tangle means twisting and tau means 6 protein. So I hope you understand. So see, in that what happened, that there is a stabilized microtubule. This indicate tau protein, this indicate phosphate. So when there is a kinase, so kinase do what? They actually destabilize the microtubule. Kinase, when there is a new generative changes happen, so kinase become active, and they do what? They destabilize the microtubule. How? They phosphorylate the tau protein. When tau protein become phosphorylate, now they detach from the microtubule. They disturb the function of microtubule. Microtubule never transmit the neurotransmitter properly, so they accumulate, forming a one monomer, then oligomer, then paired helical filament, then neurofibrillary tangles, mean abnormal twisting of tau protein. That tau protein become phosphorylated, so NFT. So this is the main histopathology or main biomarker or main diagnostic feature of Alzheimer disease, in which what happened? There is a destabilization of microtubule and formation of abnormal twisting of protein. So what's the clinical feature? Now I'm talking about what's the clinical symptoms of Alzheimer disease. First of all, there is a loss of memory. Why? Because there is a neurodegenerative changes happen in the neuron. Then there is a behavior changes, drastic behavior changes, sudden behavior changes. Patient is forgetting the things. So this is a behavior changes. Patient don't know where is he and what he is doing. Patient don't know about this thing. The difficulty in elaborate the thoughts. That patient thinking problem. Patient unable to tell others his thoughts because patient have dementia problem, and difficulty in simply doing task. Patient cannot doing the task easily because if patient cannot remember what other demands to the patient. If someone commands normal person, so normal person can easily do any task. But if you give command to the Alzheimer patient, that Alzheimer patient unable to do even simple task. If you ask the Alzheimer disease patient, just take the water and give me in the cup. So Alzheimer disease patient never, he don't understand properly, so he is not doing simple task even properly. Then there is a poor or decreased judgment. What it means? It means patient cannot judge the things properly. Actually, what is the things? Patient judgment problem become disturbed. Patient become disoriented in time, place and person. Patient don't know what is the time now. Patient don't know who is around him or her and where is he. So patient is unaware. Then there is a problem in speaking, reading and writing. So patient suffer with the problem with speaking. Patient cannot speak well, even not read well, even not write well. And problem in abstract thinking, mean patient cannot think well. So this is the main clinical features of what? Of Alzheimer disease. So this is the normal brain, healthy brain, and this is the severe Alzheimer. See, in which what happened? There is a cerebral cortex hypertrophy. There is a cerebral cortex become atrophy. So when cerebral cortex become atrophy, so all the cortex function become disturbed. Patient develops symptom like dementia. So this is the age-related cerebral cortex atrophy. This is the normal cortex. This is the Alzheimer disease patient cortex. So I hope so you understand today Alzheimer disease very well. So if you have any questions, so you can ask me in comment section. So this is about the Alzheimer disease, about its pathology, its introduction, its clinical features, and for the management, how you manage the patient. First of all, there is some investigation in which you can do blood CP, blood sugar level, or you can do patient serum vitamin B12 check, or you can do TSH level and chest x-ray. And the treatment can be patient, you can give patient drugs which can increase the memory, like you can give patient cholinesterase inhibitor. So these drugs work by boosting level of cell to cell connection by providing the neurotransmitter, because in that condition what happens, there is no neurotransmitter. So you give cholinesterase inhibitor that prevent the damaging of the acetylcholine. So acetylcholine become increased, because normally what happens in Alzheimer disease, there is a less acetylcholine, in neurotransmitter less. So when you are giving drugs, so they do what, they providing a neurotransmitter that is depleted in the brain by Alzheimer disease. So this is a thing. So in my next lecture I will talk about other disease of neurology. Thank you.